And then Caroline, feel free to share your slides and take it away.
I will do so, and thank you so much for that lovely introduction. Much appreciated. So as Kara mentioned, I'm here to talk about trauma-informed approaches to research. And I actually teach an entire course on this. I teach a summer institute on trauma and violence-informed approaches to all kinds of things, to research, to educational systems, to social systems. So what I'm giving you today, unfortunately, is one little slice, which I hope you find to be useful for what you're doing or what you plan to do. And there's, as I was mentioning in a little bit of a chat before we started today, there is really a burgeoning literature on this for researchers. It has a long history in some disciplines, not too surprisingly, like social work, and it's brand new in other disciplines. So I try to, as you'll see today, give you some examples of how to go ahead and do that in some research that you might be thinking about doing. But I'm located in Winnipeg, Manitoba, and so I'm going to start my talk today with the territory acknowledgement that the University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, Dene peoples, and on the homeland of the Red River Métis Nation. And we respect the treaties made on these territories. We acknowledge the harms and mistakes of the past and the present. And we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. So today, as I mentioned, I'm going to touch on hopefully the highlights, the important things for you, why a trauma-informed approach is important to think about in various disciplines and covering various topics of research, to talk about the basic trauma-informed principles, to share an example of trauma-informed research in action. And then I will save some time at the end today to provide an opportunity for discussion about the design and implementation of trauma-informed research protocols in case anyone has questions or an example or an experience that you would like to share. I hope that we have a chance to discuss that today. So just starting with why a trauma-informed approach is a good idea. And many of you are aware of this and know about it, and some of you might not. And so approximately 90% of adults who access public mental health services have experienced some form of traumatic event in their lifetime. There are plenty of adverse childhood experiences, as we know, that happen in people's lives. Sometimes there is a traumatic stress reaction to that adverse experience, sometimes not. But if you're doing any kind of research with people who receive care, they are likely to have experienced trauma, even if your study is not about trauma per se. And I'm just going to add here that in addition, clinicians and staff in mental health settings who often undertake or assist with research tend to have a higher prevalence of lifetime trauma than the general population as well. So trauma is happening, it's out there, and the effects are being felt among many people, whether you are noticing symptoms, whether they are reporting or feeling symptoms or not. Those directly involved in research on sensitive topics, and this can be a variety of things, right? So the ones that instantly come to mind, the most sensitive topics, usually deal with some form of violence, but not always. So it's not always intentional injury that is related to an experience of trauma. It can also be unintentional injury. It can also be a hospitalization or a medical treatment experience. Right. So, but whenever you're studying any of these kinds of things, those who are involved in the research might have limited experience with people who have a traumatic history, or a limited conceptualization of what the challenges are in working with people that have that kind of history. So this includes research assistants, of course, whether they're undergraduate students, graduate students, postdoctoral fellows, but it also includes us. It includes scholars, junior scholars, senior scholars, community members. All of us who are engaged in this kind of research may ourselves feel the effects of indirect or vicarious exposure to sensitive information as we work with the participants in our research study. So it's not just those that we are doing the research on or about or with, it's also the researchers themselves who may have their own personal trauma history, or through the experience of doing research about sensitive topics. So these topics, of course, have the potential to be disturbing and or re-traumatizing for those that are involved. And you might think, yeah, but research has to meet RAB requirements. So we do have research ethics boards that do give us guardrails and cautions and protocols. However, there is a lot that we can do to more fully support participants in terms of making our research trauma informed. And that's what I'm here to talk about today. And we do need to increase the awareness of a trauma-informed approach in all disciplines of research. So as I mentioned, the more traditional ones, such as perhaps social work or clinical psychology, but many, many disciplines now are collecting information from individuals who are either very likely to have a trauma history or to be going through a traumatic event during the time of research. And so the goal here is to prevent unintended negative consequences. So what is a trauma-informed approach? Well, if we use the standard classic definition, and this was created by the Substance Abuse and Mental Health Administration in the US, or SAMHSA, a person, program, organization, or system that is trauma-informed, and this could include your research project, realizes the widespread impact of trauma and understands potential paths for recovery. Recognizes the signs and symptoms of trauma in clients, in participants, in families, in staff, and basically anyone involved with the system. Responds by fully integrating knowledge about trauma into policies, procedures, practices, and actively seeks to resist re-traumatization. So these are extremely brief bullet points. And as I mentioned, I'm going to do a little description of them today. I can't do them fully. I can't really give you the in-depth description, but I'll do my best to give you a taste of what each of these 6 basic principles are. And whether you list them in your research protocol, or whether you just keep them in mind as you're designing all aspects of your research, it's a great exercise to keep in mind. The first principle, and it really is the priority, is safety. And this is not just guaranteeing a sense of physical safety for participants, but it also is trying as much as you can to provide a sense of psychological safety as well. And so an interview room, any place that research is conducted, whether it's on site or in the field or on a university campus, might seem like it provides a sense of physical safety. It's a room with a door, it's closed, no one can hear, no one can eavesdrop. It might seem like it's a safe physical space. But individuals that have experienced trauma, as we know, can sometimes be unexpectedly triggered by a sound, a smell, uh, a physical location, only one exit to a room, and the path to that door is blocked by the chair or the physical presence of the researcher. Those kinds of smaller details can sometimes undermine a person's sense of physical safety as well as psychological safety. And that sense of psychological safety is promoted by the other aspects of a trauma-informed approach. And so the next two are trustworthiness and transparency. So we all know that we want to build a sense of rapport, that we want to reassure the person that we're dealing with that everything they say is confidential and that their wishes will be respected. But this goal of building and maintaining trust with the person that you work with is definitely important to keep in mind, top of mind all the time. And trustworthiness can be built not only by transparency, being very clear, this is why you're here, this is what's going to be asked of you, this is what's going to happen next, but also by sharing a sense of control and fostering a sense of agency in the participants that we're working with. So that transparency is actually a big concept. It's not just knowing what the topics of the questions will be. It's also very much encouraging participants to be active in an ongoing decision-making process as they move through the protocol as to what they're comfortable with, what they're not comfortable with, what they're willing to do, what they're not willing to do, those kinds of issues. The next aspect is peer support. And in research, peer support doesn't apply as often as it would in other settings, unless, of course, you are working with participants in a group setting, such as in a focus group or in an intervention where multiple people are participating together in a small or a large group. And so encouraging and allowing different people who are brought together for this particular purpose to support each other, to honor each other, to acknowledge each other's experiences can also be a very important aspect of a trauma-informed research protocol. And that goes along with the sense of collaboration and mutuality. So the sense of collaboration is not, it is based on we are doing this together rather than something is happening to you. And so that's where not only knowing what's going to happen, but knowing that there's a much more of a power balance. Everyone has a role to play. Everyone has a role in the decision making, in what happens, in what doesn't happen, and that has to be mutual, right? And so the power is shared, and the opportunities for decision making are provided regularly, frequently, and reinforced by actually being made to happen. So we all know that if you offer someone a choice, but then you don't follow through and respect the choice that they make, you're not building trust, you're actually undermining it. So all of that decision making and all of those choices have to be real and have to be ones that can be followed up on. And so that ties into the next aspect, which is empowerment, voice, and choice. You feel empowered because you feel that if I do speak up and I make a choice here or I express what I want to express about my experience, it will not only be listened to, it will be respected and honored. So feeling heard and feeling respected in that decision-making process to the fullest extent possible promotes that sense of having a voice, having a sense of agency. And if there are parameters, if there are limitations, if there are boundaries on what aspects of the choice can be respected and honored and what aspects cannot be, then that needs to be made clear, so that, again, a person isn't being made to feel that they're being given a false choice. And that's part of the transparency. So in a research protocol, if someone has agreed that they are going to participate in a physical exam or participate in taking a certain drug or participate in answering certain questions, sometimes there is a point where they can change their mind and leave and not participate anymore. But sometimes they've participated to a point where it's no longer possible to do that. So they need to understand if there are points of no return, if there are boundaries where if they go a certain distance, then completion is necessary. That's very important for people to know as they go into it. It's very, very important that that sense of agency, the shared choices, and are all part of giving participants a voice. And as we know, some people are very comfortable with talking about their needs and their preferences and their desires, and others are much, much less so. And so providing that setting where there is enough safety, where there is enough trustworthiness, where participants feel comfortable using their voice is a very important part of trauma-informed research. And it may take time to build that relationship, may not be able to be done in one setting or in a one-off encounter. And then last but not least, and certainly not least, part of that trauma-informed approach is being aware of and sensitive to cultural, historic, and gender issues. And that's all part and parcel of being aware of what a person's sensitivities might be, what their concerns might be, what their issues might be, being as open and transparent about being sensitive to that as much as possible, creating a setting, both physical and psychological, where a person with those sensitivities would feel as comfortable as possible, whether that's the physical setting and what's contained in there. So, for example, doing an interview in a room where there's a couch and a chair and a lamp rather than an exam table and a steel bench or chair. But it can also be things like making the person aware that what they say, how they participate, the information that they share, and how that will be used and how it will be done to support and further concerns or issues that might be important and sensitive to them. So that's, as I said, a little bit of a brief overview of what these principles are. So let's talk a little bit then about how to put them in a bigger framework and then some examples of using them in action. So this particular reference that I'm discussing here, it takes a social work perspective in working with individuals that not only have a trauma history, but they're also placing it within a social justice and an intersectionality framework. And that's because the particular populations that are of interest for these researchers are definitely those that are living lives that are at an intersection between trauma, adversity, and coming from a marginalized population or background. And of course, this is very complex. This can occur at multiple levels. And so individuals may not only have personal experiences of traumatic events, let's just use a car crash as an example, but they may also be part of a marginalized population that has a history of intergenerational or historic trauma. And I will just acknowledge that today is International Holocaust Remembrance Day, and that we know from many different studies done both in Israel and outside, that many different children and grandchildren of Holocaust survivors have definitely feel the effects of the historic trauma of what their grandparents and parents went through. In addition to that, we need to be sensitive to the fact that many participants from marginalized populations are also going through ongoing experiences of racism and discrimination at differing levels. And these, of course, can be simultaneous or not. They can be in the past of the individual or current experience. They can occur at the interpersonal level, both direct and indirect, something that happens to them personally, or something that happens to someone in their family or one of their friends or someone in their neighborhood that they know about. These experiences can happen to entire families, to entire communities, at the societal level, which also includes, of course, institutionalized violence or systemic discrimination from different systems, such as the educational system, the healthcare system, the criminal justice system, those kinds of things. So this particular paper argues for a trauma-informed social justice approach to research, as they have called it. And they, rather than focusing on the trauma piece, as many people are doing these days, are trying to acknowledge that everyone that has dealt with trauma and survived trauma is on a healing journey, and that they are recovering in some way and in some aspect. And so they are talking about healing-centered engagement that applies trauma-informed principles within a social justice lens. So this is just one of many examples of current discussions, arguments, models, conceptual discussions going on in the literature about how to not only acknowledge acute trauma, chronic trauma in individual people's lives, but to set it within the broader framework of who they are, where they live, and how their ongoing lives are affecting their trauma histories and sensitivities. So I'll just go through a couple of more concrete examples of trauma-informed research in action. And this is a pretty easy one to do, that if you are doing a one-on-one interview, whether that's in person, whether that's online or over Zoom, it's very important, if you have a concern or a sense that the person that you're interviewing may have a trauma history, or you know for sure that they do, because that's why they're recruited into your research study. It's definitely important to train research assistants to watch for cues that the participant is becoming uncomfortable, that they're disengaged, to take time to acknowledge that and to respond to that. And not just what you would think of typical signs of discomfort, but when we're talking about people with actual post-traumatic stress symptoms or post-traumatic stress disorder, it's not just looking away or shifting. It can also be potential signs of dissociation, such as a fixed stare or a monotone voice, or literally no longer focusing on what is happening in the present. And so knowing that it is important to respond to distress with a focus on safety, with promotion of agency, what would you like to do? Or sometimes even more simple and more basic and more necessary offer grounding strategies to bring that person back into the moment, back into the present. Something as simple as a drink of water, taking a deep breath, standing up and sitting down. Those kinds of things can be very helpful to help a person focus in on what's going on in the present if they're finding that they're having a distressed reaction. In addition, of course, it's very important for interviewers or researchers to be empathic to those sensitivities and to those reactions without being patronizing or making assumptions that may not fit that person or that situation. So some of the questions, the interview questions that we ask, we might assume, oh, they're really hard, they're really challenging, but for that particular person in front of us, they may or may not be, depending on who they are and what their background is. And so acknowledging in an empathic way that they might be challenging for some people, that's completely understandable. And then waiting to see if the person does say it is for them in that particular moment at that particular time. And of course, debriefing at the end of interview or data collection is important, not just about the topic that was discussed, but also about the interview or data collection process. So again, this is not only acknowledging the experience of the person in front of you, but it's definitely giving them a chance to have a voice, to talk about what they liked, what they didn't like, a sense of agency, what would they like to do next or not do next. All of those aspects of a trauma-informed approach are here. So trauma-informed research not only applies to data collection, it also applies to recruitment, of course, providing transparent language so that participants know, have a fully informed choice about whether or not they want to participate. And as most REBs will remind us, emphasizing the right to refuse to participate or opt out at any time with no loss of benefit or incentive should definitely be very clear in the recruitment process. But a trauma-informed approach can also be applied to the dissemination process, where participants have a say and participate in the decision-making about how will data be shared, how would they like their contribution to the study to be shared, whether that's in a journal or other options. If that's possible, as much as it is possible to give them a voice and a choice about that. Again, with any limitations or boundaries clearly outlined so that the choice is real. And lately, more and more of us have been encouraged to participate in data sharing as a part of an open science movement. And that sounds great, that we are all much more transparent about our research and have much more access to data sets that different people are collecting. But again, very important for participants to be part of the decision-making process regarding the use and release of their specific information and data that they provide. And some of this is definitely required as part of REB protocols, but some of it is definitely additional steps that we can take if we feel that it's relevant for and useful to the participants that are involved in our protocols. And I just wanted to make a special note and emphasize and draw attention to the fact that the pandemic has had substantial impact on all of us, not just the researchers and the participants, but everyone involved in research. So an extremely quick overview of the mental impact of the pandemic. Those that have experienced COVID-19, and especially those that have had a serious illness or been hospitalized, are more likely to display levels of post-traumatic stress, as well as increased mental health issues such as depression. This is particularly the case for people that have long COVID symptoms. And as we know, long COVID is something that we are more and more aware of now and more educated about. And given the vast prevalence of COVID, it is more and more likely that people that we recruit and who participate in our research studies may have had this kind of experience, either themselves or a family member. People that had pre-existing psychiatric disorders or problems before the pandemic, on average, report a worsening of symptoms due to their pandemic experiences. And obviously, higher levels of psychiatric symptoms were reported by healthcare workers who are undergoing enormous stress and strain, and in many ways still are, given the demands of their job and how the pandemic has increased those demands. And overall, psychological well-being observed in the general public has taken quite a dip. And some people have moved on to a road of recovery, and other people are not there yet. And so when we think about the intersection of what we knew about the high prevalence of traumatic events and experiences in most people's lives within the context of the pandemic experience, it becomes even more important to think about a trauma-informed approach. So we know the significant short-term effects of the pandemic, and we are only just now starting to figure out the long-term effects of the pandemic. And so it's especially important when working with participants who are more likely to suffer severe and multiple consequences of the pandemic, who are only just now recovering, if that is the case. And that includes a wide variety of people in different contexts whose lives were seriously affected by the pandemic. So we know there have been big impacts on people who are unhoused, people with low income, people who engage in manual labor because they could not avoid exposure. Otherwise, they would lose their job. There was not possible to take time off. People who struggled with inadequate childcare, students who had studying paused, stopped, or disrupted in some way. The list goes on and on. And so some people have suffered to a much greater degree and have a much stronger sense of this is continuing in their lives versus other people who have not. And so one of the last things I wanted to talk about today is that the trauma-informed approach is not just for participants in research, it's also for researchers themselves. And so researchers may not realize that they themselves are in need of or could benefit from a trauma-informed approach. And so it is important when developing the protocols to not only keep in mind the emotional and physical well-being of the participants, but also of the researchers as well. And it really depends on the kind of research you're doing and the kind of exposure that researchers experience in the course of that research. But it's definitely important to think about minimizing harm and increasing self-care, for example, for those that transcribe and code those interviews, even though they weren't present. They didn't talk directly to the participant, but they're listening to their stories, to the things that they talked about. And sometimes those are very serious, very upsetting. They can be quite disturbing. And so having an informal support network with other RAs who are doing similar work so that they can talk about it and debrief and feel better and not rather than alone in their experiences, being aware when they are reacting to being exposed to that kind of information and that kind of data, taking breaks, of course, away from it, whether it's distracting or doing something deliberately positive, such as a mindfulness exercise or an SDR protocol, which does involve deep breathing and focusing on different parts of the body, that kind of thing. All of these things can be done to minimize the reactions and sensitivities of people doing the research, even though they were not directly involved in contact with the participants. And so my conclusions today is that there are many different benefits to trauma-informed research for the participants, for the researchers themselves. A trauma-informed approach is based on prevention. And so the more training that you have, the more awareness that you have, the less likely an adverse event would occur for both participants and for researchers alike. So many of the aspects that I talked about today, people do include as part of their IRB protocols, but we can sometimes take it a step further, elaborate on it a bit more, provide a little bit more time and space for a trauma-informed approach, particularly if we suspect or if we know that the participants that we're working with have a trauma history. So I'll just stop there and open up the floor to questions, discussions of the costs versus benefits of this approach, or what people think about what I've had to say today.
Big thank you, Caroline. That was a wonderful talk. Thank you so much. And it's got me thinking big time, but I don't want to be a hog because I know that I can. Yes, and you're getting applause from people in the room, so appreciate that. Please, if you have any questions, you can unmute yourself, raise your hand, unmute yourself, or pop them in the chat if you're feeling shy. But we're going to open up to discussions. You can ask Caroline questions. You can comment on what was said. What do you think about trauma-informed research? The floor is open. And I see Susanna has her hand up. So go for it, Susanna. You can unmute yourself.
Yes. Hi, Carolyn. That was great. That was very succinct and informative. The question I have is, has there been any research done on those that have served on juries? Because in Calgary, there was issues regarding those who are participants in juries, especially with their hearing violent or
the two of them. It was just stuck in. It was just
and so I think yeah, I think Simone's off, not muted. Anyway, so there was quite a call and need for it in Calgary some time ago. It was a couple of years ago. And where those that have participated in juries have not had any avenue to discuss, to debrief. And so what you've shown here is this trauma-informed approach has to be across all avenues in society. And it was just one thing that I remembered is that they were saying, you know, how do we deal with the trauma that we're experiencing, hearing this, you know, these particularly difficult trials where there's violence and horrific events that have occurred. And so I'm just wondering, has there been any other reach by any other groups in society other than just counselors, social workers, nursing? Because there's you know, police officers, there's military personnel, there's legal people dealing in the legal system. There's, I mean, this should be sort of like blanketed across society.
Yes, it should. And thank you for acknowledging that. The only work that I've known, the published work, and there might be stuff ongoing, of course, that hasn't reached the airwaves yet, so to speak. But the published work that I know of in the criminal justice system is almost always focusing on youth and youth detention, and focusing on trying to eliminate or reduce trauma-inducing strategies and protocols in those symptoms, such as using physical restraints, using isolation, those kinds of things that are traumatizing for all of us, but particularly traumatizing for youth that are in conflict with the law and are detained in criminal justice systems. The jury, I don't know, I hope that we would have a legal scholar or attorney during the conversation. That would be fantastic to find out if there is anything along those lines, especially when they know that juries will be facing incredibly difficult, challenging, potentially traumatic details that I think most of us would have a very difficult time dealing with. So that's a great question. And my only knowledge to this point is youth detention and youth in the criminal justice system. But I'm pretty sure some prisons are trying to adopt a more trauma-informed approach. It's a huge undertaking to change a system into a trauma-informed system.
Yes, huge. But I mean, we're starting it. So the more people who understand, the more people who can provide sensitivity and awareness to that. So I thank you for this education. This is great.
All right, Simone.
Yeah, I would like to say quite a number of things, but thank you so much for keeping the way you talked about it incredibly respectful and neutral. I know that's kind of what you do, but I know that language, the part of trauma, is so important for someone who's experienced trauma. It's so hard to then talk about trauma in a way that doesn't trigger someone. And that's huge. So thank you for keeping it so, like, I didn't feel triggered. And usually, and when we talk about difficult situations, that's really hard for me to stick through them and be like, not remember stuff. So I trigger my own self.
Yeah, there you go. I appreciate the comment, because that's definitely what my intention was, but intention doesn't always translate into what you were hoping for. So I appreciate the feedback.
Yeah. So I think on that note, can you kind of, and this is so individualized, I suppose, is like, how would you go about the language part of it? Because that was something that came up a little bit with when I went to do counseling on trauma a little bit, to kind of how to sort of open up that conversation without triggering someone. Because I know there's sometimes there might be some processes that are a little bit more standardized that might help talk about that. Because like, just for an example, back when I lifeguarded, they did a pretty good job having a system to debrief us. It didn't cover anything in the nature of actually trauma debriefing. I know that step helped a lot. Like, anytime we did actually debrief a situation, like, let's say I dealt with spinal accidents, just as not to bother anyone with that word too, because it's a big word, like how to be accurate without missing the point is tricky. But that even those debriefing for those incidents hugely helped, and why I can think back on those situations and not feel traumatized. I can remember them, but they don't cause distress. And I think it's because we did debrief. That was probably the only step that at that point was coming forward, that we had to start debriefing first responders about what had just happened. Not even just as a legal process, but as a personal process to actually make sure people were okay after what they had just gone through. That's one question, and I'll probably let you answer that before I ask any others, because I'm sure there's many questions on my mind and I have to just talk to you later.
Well, I agree with your point completely, that language is very, very important. And that's part of the transparency, right? Is if you know, because you're specifically dealing with someone that you know has had a traumatic experience or history, and you're going to ask them about it, they need to know that that is going to happen, and that you will put as many, guardrails and supports in place as possible. But even with that, they can still choose to not, if they change their mind or need more time or space to do that. It definitely is important. And this is where having participant partners participate in the research, helping to design the protocols, because someone that has been through the experience of the participants that you're looking to recruit can definitely help you with finding the right words and the language, and letting you know, at least from their perspective, what some of the important things to be aware of might be. So that is incredibly important information, which I'm very happy to see more and more research studies are including participant partners in their protocols, and that's very helpful for that reason.
Yeah, thank you. I think there's other hands, so I'll let someone else talk.
Okay, we can.
Okay. We'll come back, Simone, don't worry. So if you want to, we'll come back, don't worry. So before I jump to Carrie, there was just some comments that I wanted to make sure were heard, not questions, but I'm just going to read them out loud before they get too much. So Nicole commented that it would be good to hear from team members from Attach about how well we do with some of these things. This is important feedback that we should be getting as well. So yep, Nicole, totally agree. We should look into that. And then Christina commented, thank you so much for the discussion. As a patient partner, I find the subject has not been spoken about enough, especially in regards to the research problems and methods for patients and researchers. And then in addition, with regards to knowledge translation and dissemination, just asking patients to share stories can translate into treating those patients like data in person, which is also incredibly triggering and cause trauma. So yeah, thank you, Christina, for those comments. Carrie, your hand is up, go for it. You vanished on my screen. Carrie,
I'm muted.
There?
Sorry, I was muted. I was muted. I just thought I would add to what Caroline was talking about in terms of language and how I've used trauma-informed practice in the way that I do research. I joined a research team after the REB had been submitted, so I wasn't involved in any of that. And so when I joined the team and we were interviewing participants, and this particular project was for women who had experienced intimate partner violence in rural communities. So lots of questions that would very easily trigger somebody. So the way that I would use the trauma-informed approach throughout my interview was to first, of course, be very transparent in the beginning and just say, like, I understand that these questions can be really triggering, so that's really normal and could be expected. And so if you don't feel comfortable answering a question, then that's not a problem. So I didn't want them to feel any pressure to talk about anything that they weren't comfortable talking about. And then also, of course, even though I prepared them in the beginning, after the questions, I also debriefed with them and just made sure that they were okay. And I also let them know sometimes they might be okay right after the interview, but maybe a couple days down the line or even a month, they're suddenly being triggered and may not understand why. And I let them know that that's also normal. So normalizing those feelings that could come up, you know, as a result of having done the interview. And then because, you know, I was an research interviewer and not in the counseling position, even though in the past I have been in the counseling position, but I can't counsel people that I'm interviewing. So I would just make sure that they had somebody that like both informal and formal supports that they could go to debrief about how the interview went and if they were triggered. And the one thing that was part of the ethics submission was a list of resources. So I did refer them back to that list of resources in case they didn't have those informal supports, so that they knew where they could reach out to if they needed to. So lots of transparency, I would say, is key.
And those are great points. Thank you for sharing that. That's wonderful.
Yeah.
All right, Simone. Sorry, the comments have come up quick. Go for it, Simone.
Okay, it's me again. Okay. I think it's tricky. I think for me, the hardest triggers that have come were around violence towards children. That's the hardest point. I just recently dealt with jumping out of my car and dealing with some kids that were not doing so well and trying to find a way. And this is where I want to kind of throw this back to you about how to communicate with them about what just happened in a way that isn't going to traumatize them. Because in this case, it was just two siblings. One had beat upon the other. And initially, when I popped out of my car, I didn't know if the other child was actually in medical distress or not, because I couldn't quite tell what had happened. So I got out and I asked what had happened. And part of his body part had been kicked quite extensively. And I was in that moment of, because he's an unattended minor, how do I talk to them? And at that point, I sort of, my choice at that point in time was to say, you know, you don't do that. You don't kick parts of the body, and to kind of reinforce that safety kind of component and explain the first aid. But it was all a very hard call because I thought about it a lot longer. I talk about the days later. Yes, that's often after the emergent situation has happened, and that's when I often am the most triggered, is after when my brain's had some time to think about it. And it will bring up other experiences I've seen or had with kids. Yeah, so just wanted to ask your opinion on how to communicate when you're looking at the offender, you're looking at the victim. They're both kids. How do you communicate to not traumatize both of them as to what's happened to the person who's been hurt and what's happened to the person who's done the hurting? It's hard with kids. And you see adults, you feel much more inclined to have a system, there's all the criminalized system. But with children, it's not a crime. It's at this point, it's an action. And so it's like, how do you do that? Because I just want to hear your thoughts on that.
Yeah, that's a great question. And two thoughts on
On this poster.
there you go. Two thoughts on that. If you are dealing with adults who are in a position to talk to kids about that, so if you're dealing with a parent or a foster parent or a caregiver or a teacher, the advice is to invite the child or children or student or whoever to discuss that. So rather than asking them point blank questions, which of course kids will feel a little defensive, perhaps overwhelmed, perhaps resistant to that, just invite, if you want to talk about that with me, I'm very ready, able to listen to you about that. Anytime you want to talk about it, please feel free to tell me more, and I'm happy to hear that. And that is mostly for people in the children's lives. People in the children's lives, it's okay, who are able to provide that. But if it is, as you mentioned, if it is a
keeps coming in.
situation where it isn't a person who has a standing relationship with a child, then that's a much more difficult thing to do as a bystander or a stranger in the children's lives. So I think that's a much trickier, much more difficult situation. And I think, as you described, trying to assist the person who may need help, especially if there is an obvious injury involved, is very important. And basically just providing adult attention on behaviors that they might have assumed either no one was noticing or no one cared about might carry much more of a message than you think it does. An adult has noticed, an adult has come over, an adult is asking, are you okay? Do you need help? Can you move that arm? You should put ice on that before it swells up. Those kinds of things. Just that adult attention is perhaps not what was expected. And that can have a profound impact, regardless of what else the adult may say. Just showing compassionate and focused attention on the incident might play a bigger role than you think.
Well, thank you. It's always hard to not judge yourself after you've jumped out and you are a stranger and you've kind of said, in my opinion, you're not to kick your brother in his private parts. That's not a normal game. I think because the kid said, well, we do this all the time. And I said, well, actually, it can send your brother to the hospital. It actually can be very, very serious. And you shouldn't kick any part of him. And to try and sort of say, like, I tried to put it back on the other kid and say, okay, now you help your younger brother who you've kicked, put some ice on where he's been hurt because he was curled up in a ball. And I was, because he could stand and walk after we talked and we had enough time to sort of sort out what had happened. It's kind of was my draw line between saying, I want to call, because it's always hard because social assistants, even if they mean the best, they don't know what's happened, so they can't tell you. And as a stranger coming in on the situation, you don't ever be accused of what's just happened because you're like, no, I didn't do this. But at the same time, how do you sort of, intervene in these situations at the same time? I didn't want the older brother to feel like he was a total horrible person. I wanted to try and communicate that their activity wasn't okay. And thank you for acknowledging that the part of what I was explaining, because it's even hard to talk about this stuff without, for me. Yeah, so thank you.
Thanks for your question. Yeah.
All right, I'm going to steal the last question, but first I'm going to read one last comment. So from Stefan, I think this was after Carrie spoke. This might have been related to Carrie's comment as well. Pretty amazing to hear too when interviews provide participants with therapeutic feeling unprecedentedly. So yes. My last question, and I know we're coming to the end, so Caroline, feel free to be brief if you can. One of the things that struck me, first of all, incredibly important, because especially if you're going into communities where trust has traditionally not been present, having this trauma-informed approach, you can't talk about rebuilding trust if you're not being sensitive to what's gone through. And I've seen so many contexts where people want to rebuild trust, and then they walk in and put their foot in their mouth, like right through the door. And it's like, oh, sweetheart, that's not going to work. But it also sounds like this is almost like a social skill. Like this is something that people have to learn. And when you even talk about like not staring someone in the eye, being careful about your body language where they position themselves in the room, and not everyone has those sets of skills, for better or for worse. So if there is an organization that is aware that they are in a situation where they need to build trust, they need to work on their social skills, they don't have training and counseling and things like that, where are some places where they can go get hands-on training in these trauma-informed approaches so they can start applying that to their own business activities?
Yeah, that's a great question. And there are some wonderful resources in Canada, and some that are led, spearheaded by Indigenous communities for that specific purpose, and others that are just broader and more general that can be applied to lots of different contexts or backgrounds. So just a couple that spring instantly to mind. One of the references that I cited in my presentation was from UBC, and they have a wonderful collaboration with elders and knowledge keepers about how to specifically, the reference I cited was how to specifically take the pandemic into account when trying to work with First Nations communities, because as you mentioned, in many scenarios and situations, that is already a community that has had their trust violated many, many times and are completely justified in needing a lot of trust building exercises in order to get anywhere close to feeling safe, physically, psychologically, culturally, in any way, shape, or form. Makes a lot of sense. There are other organizations, and I know of Clinic in Winnipeg, Clinic spelled with a K, and they have been Manitoba leaders in trauma-informed approaches. So I believe during the pandemic, they started offering either half-day or full-day online training. So there is that. You don't find it very often at post-secondary education institutions, unfortunately. So yes, I offer a full course, which is a lot, but I do get an awful lot of social work graduate students, education counseling graduate students, undergraduate students who are applying to nursing or medical school, that kind of thing, who are willing to invest an entire week of their lives in learning more about the trauma-informed approach. But you can find online half-day and full-day seminars, webinars, workshops, and sometimes you will find them as part of pre or post-conference workshops attached to a conference about trauma, a social work conference, that kind of thing. So you do have to sort of watch for them, look for them, search for them. It's not as prevalent and as widespread as it should be. It should be easily available and adopted in all basic training of everybody, as we mentioned, not just health professionals, but anyone serving the public. You would think, you would hope, but we're not there yet. We're not there yet with continuing education programs. But those are the two that come to mind most easily, that are well known and well respected. UBC and Clinic with a K in Winnipeg. So that's what I've got, but there probably are resources in Calgary, I would imagine, somewhere, or Edmonton, or somewhere out there that that have that kind of training. And it is very important, even though you think or assume that you have a trauma-informed approach, there's always more to learn, no matter how much you've done it or how long you've used it. There's always more to learn. It's an evolving science, as most science is. So getting updates on a continuing basis every once in a while, I would strongly encourage people to think about that.
Well, we're going to be tapping you, Caroline, for the AVA program. So be aware that's going to be coming through as well. But thank you. Oh, and Yelena, would it be possible to share a link or some information on how to sign up for your trauma-informed course? Is that a course that's widely available, or do you have to be a student at the university to take it?
I don't think you do. So I will check that out. I will send you a link, and we'll see what we can do about making that hybrid, so that people that want to attend online can do that.
Okay, I will follow up with you and we'll send it to the participant list. Yelena says thank you. And Carrie also echoed a bunch of resources, as well as the clinic, and pointed out that the University of Calgary has that part of their curriculum. Yeah, so excellent. So yeah,
Fantastic.
so we will continue. I'm aware that we're a little bit over the time, but we will continue to disseminate trauma-informed, make it big, powerful. So thank you so much, Caroline, for your wonderful talk today. And yeah, thank you everyone for coming and for sticking with us all the way through to the end. This is the last bittersweet announcement attached webinar series as well. I think, like I said, we went out with a bang. Caroline, you had promised and you delivered. Thank you. And yeah, Nicole, you brought your camera back on. Do you have comments, or am I fitting you on the
Just
spot?
wanted to say goodbye. Thank you. And it's been great to have you here, Caroline. You really did